Now, the state of Ohio announcing the number of new weekly COVID infections. They do that every Thursday, and today, just like recent weeks, that number went up. Lead investigator Brian Duggar joins us live in studio with an update on what we saw today. Brian?
Yeah, you're right. Once again, we saw a jump in weekly cases. Over the past week, Ohio had 8,607 new cases, which is about 800 higher than we saw last week. So we are seeing the highest numbers since March, and this number is likely a dramatic undercount because few people are actually taking tests. And as strange as this sounds, that could be a positive thing. People aren't feeling sick enough to actually take a test. But here are a couple other encouraging signs. The jump in cases this week was much smaller than previous weeks, and when we look at wastewater data, which usually offers a precursor to big jumps, the spikes simply aren't there. The numbers are mostly flat. Now, Dr. Brian Kaminsky of ProMedica acknowledged that hospitalizations are rising and it's still a threat, but the disease shouldn't be feared.
I think overall, the best way to look at it is that the amount of severe disease that we're seeing in people is far less than it was in the past. But there are people that develop it, and it mostly is in those predictable groups that have significant risk factors, either elderly, lots of comorbidities or other diseases that increase their risk, people who have compromised immune systems, or all of the above are the ones who are ending up in the hospital.
Now, one other note, 3 years later, we have much better COVID treatment, including Paxlovid. Numbers are up, but this isn't a reason to panic. Reporting in studio, this is Brian Duggar for WTUL 11.